Welcome everybody for part two of our live resistance training class. Thank you for joining us. So this week, Rob and I will be presenting another set of exercises that you can try at home. And we will also include a warm-up and some stretching as well. So there is, that's myself, Renee Konidis, clinical coordinator and cardiac rehab supervisor at UHN's program. And then my colleague Rob, who also shares the same role as myself, will be demonstrating the exercises. So the plan for the session, we are going to show you some exercises that will help to strengthen your muscles. And we've spoken previously of the importance of strengthening your muscles and how that can help to benefit your overall your cardiovascular fitness. And we'll show you a few modifications for some of the exercises so that they will suit your individual abilities. All right, our standard slide. Remember, these sessions are for education only. Talk to your own healthcare provider for your specific advice about your own situation. We'll answer some questions as we go through the presentation. And again, we'll keep those general. And if we don't get to all the questions, we will be posting answers in a few days on the Cardiac College website. All right, so these exercises are designed for those who are currently part of a cardiac rehab program. If you are not currently within a program, maybe watch the video first and then talk to your doctor about the exercises. And then you can always come back. These sessions are recorded, so you can catch the sessions from the website if you'd ever like to watch them again and run through the exercises and go along. If you are following along with us today to do the exercises, you should not feel any pain anywhere. Nothing in the joints or sharp or pinching pain. Everything should feel comfortable. So before you get started with us today, we want you to think about, have you been feeling well this past week? Right now, you should be free of any chest pain, shortness of breath, or dizziness. You should feel well and ready to exercise right now. Think about, did you take all of your medicine today as you normally do, your regular prescribed medicine? And if you are living with diabetes, is your blood sugar at a safe level right now for you to exercise? Remember, any type of exercise can lower your blood sugar. So just be mindful of that whenever you are doing any activity. Okay, so there's Rob. So once again, Rob is in our kitchen at work. So fairly small space, small fridge. And so with the purpose of us doing this in the kitchen at work is to let you know that we hope that you can do these exercises anywhere at home. So any small space that you have at home. There's a question about what is the safe level for a blood sugar if you do have diabetes. So it's important that not everyone is at risk of having a low blood sugar, mainly those who are using insulin or on certain medication, more commonly glyburide, diamicron. Those are the ones that can make your blood sugar go down below 4. So anything lower than 4 you should definitely not be exercising, that you need to treat that low blood sugar. Ideally, if you can start exercise at least above 5.0, then ideally that would give you some room. And again, think about, when was the last time you had something to eat today? Was it breakfast and now 4 hours have passed and you've had nothing? Then you might want to have a quick snack before exercise so that you don't drop too low. All right, we will get started with a warm-up, our dynamic warm-up. So the first exercise is just marching in a spot. Bringing your knees up. This just helps get the blood flowing, getting your muscles warmed up before you exercise. And you're doing each movement here about 20 seconds or so. All right. Next, we have the shoulder rolls. So nice big circles, rolling your shoulders back a few times. And then you're going to switch directions and roll your shoulders forward. Great. All right, next exercise is the hip swing to help loosen up the hip joint. So holding on to something for support, for balance, you are swinging one leg at a time, just a nice gentle back and forth swing, keeping your upper body as upright and still as you can. So it's only your hip and leg that's moving. Also look straight ahead. Keep the rest of your back in line. Good. And then you can switch and do the hip swing for the other leg. So again, holding on for balance, looking straight, keeping your upper body still, and a gentle swing of your leg back and forth. Okay, and the last warm-up exercise is the ankle rolls. So hold on for balance, lifting one foot up and just rolling your ankle around. Nice big circles. Round in one direction, and then you can switch and roll around the other direction. Okay, other foot. Rotate your ankle around. Nice big circles if you can, intentional movements with your foot right around, and the other direction. Great. Okay, so we'll get into the strengthening exercises next. We are going to show you 5 different exercises than what we showed last week. So the first one is the alternate arm and leg extension up against a wall. So for this exercise, we want you to find a flat, clear space on the wall. So Rob's using the door there. You'll have your hands in front of you supporting yourself against the wall. And this exercise is for all the muscles in your core, in your lower back, all the muscles that run up along your spine. So this is strengthening your back and your core. So you'll lift one arm up and the opposite leg kicks back just a few inches. So you see Rob's right arm up, left leg out. Then left arm up, right leg out. And I'll just get Rob to show you a side view, what this will look like. So Rob's just switching onto the other wall. So you'll notice Rob's leg is just going back about a foot length back. So just a few inches. Don't reach your leg too far back. Otherwise that can aggravate the small muscles in your lower back. So it's a small movement with your legs. And then your arms are reaching up the wall. And so for every exercise, we are doing 10 repetitions. So for this one, it will be 10 times each side. So it'll work out to 20 times altogether if you're counting each side separately. Rob lost count, but he thinks about 10. Remember to also keep breathing with all of these exercises. Don't be holding your breath. You want your breath to be continuous as you're doing all of the strengthening exercise. All right, the next exercise is a seated curl up. So this is for your stomach muscles and core muscles all around as well. So using a chair, this is a nice alternative to doing a curl up on the floor. We will show you that one next. So this is first in a chair. We want you to slide forward so that you're sitting closer to the edge of the chair. Okay, and then you're going to sit up tall, so a nice flat back. So there should see a nice straight line running from the back of your head all the way down your back. And the first thing you'll do, just keep your hands nice and relaxed. They can be on your lap or at the side. And then slowly lean back to touch the back of the chair. And then slowly sit up tall again. So you're hinging from your hips, lean back and sit up. Keep your eyes looking straight forward. Don't lean your head back. That might bother your neck. Yeah, and don't curl your back and fall into the chair. You want to pretend there's a wooden board attached from the back of your head all the way down your back. So you have that nice straight line as you curl back. And it looks like a small movement, but you should feel this right away. All your stomach muscles will tighten up as you're trying to slowly control yourself back into the chair. Progression to make this a little bit more difficult is if you change the positioning of your hands. So Rob is just crossing his hands across over his chest, and it just changes the length of the lever of the upper part of Rob's body. So it makes this exercise more challenging. If it still feels too easy for you and you want to make this a little difficult, we're going to really work Rob here. The next progression would be just have your fingertips at your temple. So again, changing the length of the lever arm, bringing the arms up a little bit, makes it a little more difficult as you sit up. And just another point, sitting on the chair there, so the closer to the edge of the chair, the more difficult it is. That's another way to adjust the intensity. See, that was too tough for Rob, so notice his feet were coming off the ground. If it's too tough, wiggle back so you're not maybe just past the midpoint of the chair, and that lowers the intensity. So play around with your positioning until you get to a point where you can do 10 repetitions in a row comfortably, and make sure that you finish that 10th one. Good, and again, really important to breathe. So as Rob sits up, back to the middle point, he's breathing out. Nice big exhale as you sit up. Don't hold your breath and strain as you sit up. All right, next, so we will do a similar exercise, the curl up, but this is just a different position. I wouldn't necessarily say more challenging. I think they both can be challenging. Just it's more about preference. If you prefer to do the exercise in a chair or lying down. So Rob has an exercise mat, but you may not have one of those at home. So you can find something that works for you at home. Maybe you have some extra towels you can put down onto the floor. Just gives you a little bit of cushioning. I would not recommend doing this on a bed or a couch, nothing that's too soft, because that will affect your form as you're doing the exercise. So ideally firm ground, but a couple layers of towels is fine, just to help with some cushioning. So notice how Rob is getting down to the floor, very a strategic way. So you come down one knee at a time, then you can move on to all fours, and then to the side, so you let your hip come down. Slowly lower yourself flat, and then you can adjust and roll onto your back. So take your time getting down to the floor as well as back up. Okay, so Rob is in position to do the supine curl up. So for this one, we recommend to have one knee bent and one leg straight. This just helps to lock your pelvis in place and make sure that you're only using your abdominal muscles. You can take your hands and just tuck them into the small of your back, the little space that you'll notice in your lower back between your back and the floor. And when you're ready, you lift your head, neck, shoulders, a little bit of your upper back off the floor to curl up. Notice that Rob's eyes are looking straight up at the ceiling, and that helps keep your neck straight and in line with your back, as opposed to curling your chin down. Also, try not to use your hands to push your upper body off the floor or your elbows. Your hands should just be relaxed at your side and let your stomach muscles do all of the work to pull your head and shoulders up. Yeah. And you don't even have to go very high. So Rob's got it one hand on his stomach, and as soon as you feel those stomach muscles tighten up as you lift your head and neck, then you've gone high enough. Really important to breathe with this one again. So as you're coming up, lifting your head, big exhale, empty out your lungs. And that helps you to keep the rhythm of your breathing. Okay. Next exercise is we call the bird dog on the floor. So Rob is going to slowly turn over to change position. So again, rolling over to one side, using his arms to push his upper body up to a seated position on the side of his hip, and then slowly rotate to hands and knees. So this exercise, the bird dog, again, lots of core muscles that are being used here. Similar to the arm and leg extension that we did up against the wall. Similar movement, similar muscles are being used. This is just a different way to do that exercise down onto the floor. So starting off, hands and knees, make sure that your knees are below your hip, hands are below your shoulder, and then you would lift alternate arm and leg. So left arm, right leg, right arm, left leg. And notice how Rob is lifting his limbs and they are parallel to the floor. So there's a nice straight line running down his arm, down his back, and down his leg to the bottom of his foot. And you go side to side. Take your time. This is a good balance exercise too. So take your time as you're shifting your weight from one side to the other. And good exercise for coordination as well. Sometimes it takes a minute to think that you're lifting the correct arm and leg. Make sure you're lifting the opposites. And going through just like on the wall, so 10 times for each side. So 20 in total if you're counting them separately. And keep breathing. Don't hold your breath. Also, Rob is looking straight down to the floor. So that keeps his neck straight in line with the rest of his spine and his back. Don't try and lift your head to look up because then you'll bother your neck. Okay. So that was the bird dog for your core muscles. Next will be a bridging exercise. So the bridge exercise is helpful for your hamstring muscles in the back of your leg and your back as well. So again, Rob took his time to slowly turn around onto his back. Just showed you the hamstring muscles at the back of your leg. So starting off lying flat, hands relaxed at the side. Knees are bent. And you'll notice Rob just moved his feet off the towel, which is a good idea, so that his feet have good grip onto the floor, just so they don't slide around. So Rob is lifting his pelvis up from the floor so that you'll sort of see a straight line from Rob's chest and down his legs once he's in that raised position. There you go, nice straight line. So you're just moving slowly with this movement. And this is using all the muscles in the back of your leg and your back as well. Your shoulders and head and neck are firmly on the ground. And keep breathing. So you'll do this one 10 times. Okay, good. So those are the 5 exercises. So if you combine the 5 exercises that we did last week, as well with these ones, you've got a complete program covering all the major muscle groups of the body. So you can always come back and watch these recorded sessions and follow along doing your exercises. And we'll just move in now to the static stretching. So this is sort of like a cool down for the end of exercise. Good idea to stretch. It can help relieve some muscle soreness that might happen the next day. Oh, Rob's showing us how to slowly come up from the ground. So from your side over to hands and knees, and then one leg at a time comes up. Use a chair if you need to push the rest of yourself up straight. Take your time. Sometimes it can make you feel dizzy coming off the floor. So just change positions very slowly. Don't get up too quickly. All right, I just have a comment here in the chat box. So there's a question about an alternative for the last exercise if you cannot get down onto the floor. So alternative for the bridge. So the bridge was using our hamstring muscles in the back of your leg. So another exercise that you could do We have another exercise called the leg curl, which uses equipment though, that uses a TheraBand. But Rob's going to demonstrate the leg curl. So holding on to something sturdy like a chair, upper body is up straight. And then looking straight, feet about hip width apart, and you would curl one leg up to 90 degrees and back down. So the knee joint is at 90 degrees. So this is using the same muscle, the hamstring muscle. When you do this position, oh yes, this is incorrect. If you bring your knee too far forward, that is the incorrect position. You want to make sure that your knees or your thighs are in line with each other as you curl your foot back. So Rob is demonstrating this without any equipment. So doing this is without a TheraBand or any resistance. This is a lower intensity exercise, which is fine. This might be appropriate for you. If you do happen to have resistance bands at home, we do have a video of this exercise on Cardiac College where the resistance bands are around your ankles, and that adds resistance as you lift your foot. All right. Okay, I see another question in the chat box. I'm gonna save that for the end. I don't see any more specific questions about exercise modifications. So I think we'll move into the stretching now, and then I can answer those questions. All right, static stretching. So these stretches are a little bit different from the beginning ones because we are holding them really still. So first one is the shoulder stretch. So Rob has got his one arm reached out and across his body, using the free hand to just push a little bit above or below the elbow. And you're stretching around your shoulder muscle there. So once you're in position, hold that really still, about 20 to 30 seconds, and breathe. Really important when you stretch. Nice big breaths. Every time you exhale, your muscle is going to relax just a little bit more. So big intentional breaths. And then don't forget to do the other side, other arm. Reach forward and across. You can pull your arm into yourself. You're just pulling in just to the point of a little bit of tension where you feel that stretch for the shoulder muscle. And breathe. Okay, the next stretch is for the chest muscles. So you can bring your hands just behind your back, clasp your fingers together if you can. If they don't reach, that's okay. Just reach backwards as Rob is doing there. And the intention is to bring your shoulder blades close together. So opening up your shoulders, rolling your shoulders back, and then even looking up just slightly as Rob is doing gives you a little bit more of a stretch all across your chest muscles and the front of your shoulder. And breathe. Okay, the next stretch is the hamstring stretch for the back of your leg. Rob likes to do this one in a seated position. I prefer seated as well. It allows you to really focus on the muscle that you're stretching. So moving forward to the edge of your seat, one leg is bent, one leg is straight. The straight one is the leg that you're stretching. And then hinge forward at your hips, just lean forward, toes up to the ceiling, just reaching enough until you feel a little bit of a pull or tension in the back of your straight leg. That's where you're stretching. And even in this position, as you're curling forward, you may end up holding your breath because your lungs are a little compressed, but don't let that happen. Nice big breath. Big exhale. You may notice as you exhale, your muscle relax a little bit more, and you can even reach an inch forward more. Don't forget the other leg. So switching the position of your legs, toes up to the ceiling. Big breath, reach forward just until you feel a little bit of tension in the back of your leg. Okay, so the last stretch is the calf stretch. So this is the muscle in the lower part of your leg. For the calf stretch, you can use a wall or a counter to lean up against. One foot is forward, one foot steps back. Your toes should be pointing forward in the same direction, so your feet are parallel to each other. Front knee is bent, and just lean forward just enough until you feel that stretch in the back leg, in your calf muscle, down there where Rob's pointing. So leaning forward and just hold really still for about those 20 seconds and big deep breath as well. Okay, don't forget to switch legs, do the other side. And you'll notice from this back view, you can see Rob's feet, they're pointing directly forward. And keep that back heel flat on the ground. Okay. Good. So that is our routine for today. I will I'll open up the, oh yes, don't forget to drink water. Good idea. Okay, there's one question. If you could type any questions now into the Q&A box, and then I can get to those. There's one question here asking, I have stents. Is it safe to do these exercises? Yes, so if you are had some stents put in, usually you wait a few weeks and you have some follow-up appointments with your doctors before you get into a rehab program. But once it's been a few weeks after your stents, maybe 2 to 4 weeks, and you've seen your doctors, you are ready to do these exercises. And again, that's a general piece of advice. Everyone's a little bit different. Oh yes, Rob's reminding me. So depending on the location of your, where they went in for the stent, sometimes in the wrist, sometimes in the groin, you want to make sure that those sites on the outside are fully healed and they're not sore before you do any of these exercises. But as far as the stent on the inside, it's in there good, it's safe, it's not going to move around. And so these exercises are safe. The other question I see is from previous, asking about a safe level for blood sugars. And so as I was saying, anything under 4, that's too low. You need to treat your blood sugar, your low blood sugar right away by drinking some juice or some sugar tablets. Ideally starting exercise where you are at least 5.0 to give yourself some room. If your blood sugar is really high, higher than usual for you, maybe take a break that day. Up in, you know, if you've got a blood sugar high up in the 20s, that's probably not common, but maybe not a good idea to start doing some exercise on a day like that. And reach out to your doctor or your diabetes team. Okay, another question. I need to do most of these exercises standing because of knee and hip replacement. So that's okay. You can do a lot of these, the standing ones. So instead of getting down onto the floor as Rob did, you can do that standing arm and leg extension. You can do things sitting in a chair. Last week's episode, you can go back and catch that. We showed a few more exercises that you can also do either sitting in a chair or standing up against the wall. So you can have a look at those alternatives. And I don't see any other questions. I think that's, oh, one more here. Stairs, how many flights, how fast? Post heart attack and stent, when is it okay to start? So after heart attack and a stent, usually 6 weeks after is when you would have some follow-up appointments with your doctors. You might have been sent for another stress test after your procedure. And so just checking in with your doctor if you're able to exercise. That's usually when referrals are made to cardiac rehab at that point. And then you would be linked up with an exercise team at cardiac rehab who would give you specific advice about how much exercise to do. So it's hard to tell you exactly how fast you should be going up the stairs or how many to do, or normally we start off with giving exercise advice based on flat ground, so not necessarily starting off with stair climbing as a form of exercise. But for most people, you can probably climb a flight of stairs as needed, functionally, just to get to the second floor of your home. Just paying attention to your level of breathing. Take your time if you need to as you go up the stairs. Okay, another question. Oh, just a comment that cardiac rehab is online in Ottawa. There's no in-person appointments. Yes, so I think that's everywhere right now. Even at our center, we are not having any in-person appointments or visits. Our outpatient clinic is closed, but we are doing as much as we can virtually, having phone call appointments with patients, even getting new patients started on the program by having an initial phone call appointment with a doctor before they meet their rehab specialist. Is there a special board to use when I do exercises on the bed? Not that I know of. Again, I was saying before, I do not recommend doing the floor exercises on a bed where the surface is too soft. You won't get the same effect and you'll sink into the mattress and it won't really work. So that's why ideally to do those lying down exercises on a firm surface like the floor. Another question, my heart rate is 128. Should I keep exercising? Really hard to answer that. That's a very individual question. Everyone can have such different heart rates based on, think about how you feel. Oh, Rob's gonna jump in here too. Go ahead, Rob.
See if I can make the tech work. Heart rate guidelines are kind of tricky to go by on a general basis. There's some simple general guidelines you can use though, as long as you're feeling well. I mean, exercise should be pain-free at all times, whether it's stretching, whether it's the resistance training I've been showing you, or whether you're doing your cardio. Breathing a little bit more is to be expected. It is exercise. You need more oxygen, and you get that by breathing a little bit more, but you should never really experience any pain. If you do have any pain, you should be slowing the pace down until the pain goes away, coming to a stop if the pain goes away, and if it doesn't go away, you need to access EMS. So it should be pain-free. Likewise, when you finish a workout, you should be pretty much recovered within at least 1 hour. If you're 2, 3, 4 hours after a workout and you're still really tired, you probably worked out a little bit too hard and you should consider backing off. But a heart rate of 128, if you feel well, no symptoms, no problems, and an hour from now you're feeling great, I don't think there's any specific concerns to worry about a heart rate at that level as a general guideline. Thanks, Renee.
Thanks, Rob. Another comment here. What if you cannot go down on the floor? How do you do that exercise? Oh, I think I might have answered that one. I think that was referring to the bridge exercise, and we showed you the leg curl for the hamstring muscle. Another comment, someone mentioned that they felt breathless during these exercises. So really important to pay attention to your breath. That's a great way to tell how intense you are working your body. And we want your breathing to be comfortable. So take your time as you're moving from one exercise to the next, or changing positions, getting down to the floor, getting back to a standing position. Really take your time with that. Don't rush through the exercises. And as you finish 10 repetitions of one exercise, stop, take a drink of water, give yourself a few seconds, 30 seconds, a minute, to sort of catch your bearings, get your breath back before you move into the next exercise. You don't have to go through these quickly. The purpose is not to get your heart rate up and keep it up as you do with your walking exercise. Another question, on the scale of workout intensity, where should you be at the end of a workout? Oh, good question. So the RPE scale, the rate of perceived exertion, that's a scale that we use. It's your own perception when you look at that scale to measure how hard do you feel you were working. And so we want you to be between the level of 11 to 16 when you're doing resistance training exercises. Question, can you take a bronchodilator before exercising? So that's probably like some people may have puffers that they use for asthma or COPD. If that is your usual routine to take a puff of your bronchodilator before exercise, yes, go ahead and do that. Again, everyone's going to be a little bit different, and you might want to ask your own healthcare team for specific advice for yourself. But that many people do that before an exercise session. And I think that I don't see any more questions. All right. I think we'll end that there. Thank you, Rob, on site. All right, so stay tuned. Oh, I'm just going to go back to my screen and share my screen here. Okay, so just a reminder, I didn't change the slide. Next Monday, we are closed for the stat holiday, the Victoria Day holiday. So no session on Monday, but there will be a session Tuesday at 1 p.m. That one, I believe, is talking about smoking cessation, so quitting smoking. As well, next Tuesday, May 19th at 10 o'clock in the morning. So that's part of our Women's with Heart online sessions. So those run every Tuesdays at 10 a.m. And next Tuesday's session is being run by Dr. Carolina Carvalho, and it's talking about Beyond the Heart, Her Mind Matters. So you can catch that next Tuesday in the morning session. All right. Thank you for joining us. And we hope to see you back next Thursday. I believe we are talking, we won't do an exercise session, but then the week after that, we will do another live exercise if you'd like to follow along. Thanks for joining us.